Chalasia are inflammatory lesions of the eyelid. All of us know that. We deal with it all day long. And as a clinician, I'm always looking for something new to offer my patient. Traditionally, they've been sent home with warm compresses, maybe some topical steroid and antibiotic combinations. Sometimes they require incision and drainage. Sometimes they require an injection of Canalog. But not everybody is going to tolerate or accept an injection, a drug, or a procedure. And so there's a new way of addressing them. We've had wonderful success in our clinic addressing Chalasia with intense pulse light therapy. And the rationale behind that is the anti-inflammatory properties, the antimicrobial properties of IPL, and the anti-metabolic properties of IPLs. In other words, what I mean by that is something called photobiomodulation, which is a big word, but it makes the cell act energetically more active. It stimulates the mitochondria so that the cell actually functions and performs better. It's a healthier cell. So when you take the context of an inflamed lid, in the case of an acute Chalasia, you can address the bacterial or Demodex component, the inflammatory component, and the vascular component with the IPL therapy. Now keep in mind this is with a laser grade eye shield in place. But we also have surprising success with chronic Chalasia, including ones that have had prior incision and drainage that were refractory to that management. So we have a case series of both acute Chalasia and chronic Chalasia showing excellent success with being managed with intense pulse light therapy. Patients really appreciate the drug-free, drop-free, incision-free, injection-free option. One of the challenges with Chalasia is if you are headed for an important function like a job interview or a vacation, and this happens a lot. Our patients have busy lives, so they'll come in with a big Chalasia and you don't necessarily want to cut into it because they're headed to a scuba dive vacation the next day where the water's going to be dirty and you don't want any kind of wound around that kind of an exposure. So to have the option to offer them something that's fast, efficient, and incision-free is very, very interesting. I'll have patients tell me, when did it go away? And in the case of the acute Chalasia, they'll say, oh, it was gone by 3 to 5 days. Fantastic. It's pretty hard to get there that fast with other modalities, so that patients really appreciate the speed of resolution, the completeness of the resolution, the fact that I'm actually treating some of the comorbidities that created the problem in the first place, as well as the comfort of the procedure. Take-home message for using IPL for Chalasia management is think outside the box. We're using more and more technologies from our colleagues in other specialties to address things uniquely in ophthalmology. It's indicated for inflammatory skin lesions and benign skin lesions, and that's what I'm doing. I'm using its indication on the lid, which is a part of the skin, with appropriate corneal shield eye protection in place to address a uniquely inflammatory problem. And patients really appreciate the option.